Now I'm going to welcome you. Hello, everyone, to the April 2022 IGRI seminar presentation. Many of you probably already know me, but my name is Uta Brady. I'm a postdoc here at Arizona State University and also IGRI's associate director, and my dog has now decided to join me. So welcome to her as well. Quick announcement before we get started. As many of you probably already know, the second annual IGRI conference will take place in about 2 weeks, June 20 to 22nd, and it's online. Registration to participate remains open until June 15. And I will copy the registration link in the chat for you. If you haven't registered yet, I encourage you to consider doing so. First of all, it's online. We have some very interesting presentations, among them from quite a few promising emerging scholars, grad students that are presenting their research. So it should really be a fun workshop or conference. So I hope you join us. With me today is also Saba Siddiqui, who's the co-director of IGRI. And Saba, did we have any other announcements to make today? Did I forget something besides the conference?
No, I
sorry. Okay, yeah. All right. Seemi, are we ready to share Seemi's slides? So joining us today from Lahore, Pakistan is Seemi Waheed. She's with the University of Management and Technology. And she's joining us very late. It's very late in Lahore, so we really appreciate her being here. Seemi studies water policy, collective action, and policy design in the context of rural water supply systems. And she also has experience working as a civil servant in the federal government in Pakistan and as a project coordinator with the Punjab Second Family Health Project. So she has a very well-rounded background. And today she's going to be talking about her research into the vertical synchronization and policy design and implementation for effective governance of rural water supply using the institutional grammar. So please join me in welcoming Seemi. We love to have her here. Saba, do you want to go and share the slides?
Seemi, they didn't come through to me just yet. Oh, here they are. Great. Seemi, please just let me know. You can just tell me next and I'll advance the slide.
Thank you. Thank you. Well, thank you very much. Should I start now?
Yeah, whenever you're ready.
Yeah, I'm ready. Thank you very much. And thank you for bearing all this technical hitches and difficulties. I'm grateful for providing this opportunity to me to talk about my research. It's a research paper from a larger research that I have done. And the topic is vertical synchronization in policy design and implementation for effective governance of rural water supply in Punjab, Pakistan. Please, next. Next, please. Okay, this is just the sequence. I'll just flash it and I will not go further on it. Next, please. Well, Pakistan has a population of 220 million people, and Punjab is the largest province, which has 52% of population. And of this 52% of population, 64% live in rural areas. As late as 1960s, wells and hand pumps were the main source of drinking water, and of course the surface water as well, but mainly it's the groundwater that is used for irrigation as well as for domestic consumption. And rural water supply system was introduced in 1970, and this was a command and control management. The government was the supplier of water. And there at that time, Housing, Urban Development and Public Health Engineering Department, henceforth, I'm going to call it as PHED, supplied water to the rural areas. It was in 1994 that community managed rural water supply was introduced at the behest of Asian Development Bank and World Bank in most of the developing countries. And you see the examples in African countries as well. It is the same time, it's the same period. And the reason for having these community managed rural water supply was that government budget was not enough to supply water totally entirely by them. So it was given to, the responsibility was given to the communities. Next, please. So in the early period of community managed rural water supply, there was no policy. All this was done on the executive orders, mainly day to day or whatever that the frequency of the period. Whenever there was need, it was a executive orders that these rural water supply was run. It was in 2010 when PHED made rules for managing these rural water supply, and they developed what was called as the Manual 2010, and that was done in 2010. It's called the manual. I'll just use it as the manual because this was both a document for training the community-based organizations and as well as running the rural water supply. While this manual was made, at the same time, the department, PHED, started making a bill for approval to the provincial legislature. But it continued to improve it, develop it as till 2019 when the irrigation department made a law, which was the Punjab Water Act in 2019. Next, please. This law oversees both urban and rural water supply system. It doesn't make any distinction that there is anything for the urban areas and rural areas. And when we talk to the concerned people in the department, in both the departments, they say it is an overarching law. However, the peculiarities of the rural areas are different because the rural water supply are managed through a participatory, collaborative, community managed approach. And this really stimulates interest to understand the design of the policies that was made in 2019 and the policy which was in existence from 2010. Therefore, next. Therefore, the questions that, next please. Therefore, two questions that emerged from this problem is the two policies that the manual 2010 and the law which was made in 2019, that do these two policies synchronize, and do the two policy documents support the participatory collaborative implementation, and is there connectivity and oneness in the purpose, the actors, their actions and implementation tools in the two documents to govern rural water supply? And the second question is, how does PHED as an organization connects itself with the communities? Next, please. We begin with operationalizing the concept of synchronization and theoretical framing of how do we embed this into. So we start with this problem, understanding this problem. It's guided by the institutional analysis and development framework, and IG is one of the components of the framework. We also draw from the policy design and collaborative governance theory. And the main core element of IAD is action situation, which characterizes by two or more individuals who face a set of potential action that jointly produce some outcomes. That's an action situation definition. And in this particular situation, we say that the action situation in this empirical study is the actors, their activities, which include providing water supply infrastructure, handing over rural water supply to community, water charge collection, water quality monitoring, water payment enforcement, and enforcement of rules at the operational level to manage these rural water supply. And we also understand that policy design, when we are studying policy design, it's a complex of policy goals, and it also tells us what are the means of achieving those goals. Next, please. Collaborative governance theory. Yeah, collaborative governance theory is, again, it is it says that when more than one or more than one actors, they collectively manage a collective resource, and they reach an agreement or consensus to achieve certain common goals together. So it means that there are more than one actors, and these actors could be individual or group of people, or these could be organization, a public sector organization coming in contact with the communities, or coming in contact with other organization, and they agree upon, they have a consensus that they would do these activities together. While synchronicity, if we look into literature, what we find is that it's also about that there are independent units who go beyond. This is a concept of boundary spanning, that they go beyond their boundaries to engage with contrasting units. So these two theories, these two concepts really link together, and they support each other. And when there is a synchronicity between these independent units who are independent, and sometimes in literature we find that these are also mentioned as fragmented units, and but autonomous, and they are engaged in activities which are interdependent, and when they do that, they create a joint meaning. Also, the literature defines it as the oneness or unified whole and connectivity. Altogether, what I understand after going all through this literature, it is that these independent units, that they have to come together, they have to connect themselves to create any meaningful outcome. So that's what synchronicity is, that is we are trying to understand. This research, please, next, please. Next, please. This research contains that synchronicity is necessary for, no, go back, please. Go back. Yeah, this research contains that, this is slide number 9. Yeah, slide number 9. Yeah, thank you. This research contains that synchronicity is necessary for enduring collaborative collective action. So this is what this research is looking at. And moreover, participatory collaborative approach is one of the tools for policy implementation, which involves the interdependence and simultaneous actions of the actors to achieve collective goals. The measure of participatory collaborative approach, which we have tried to also include, is I've included is aggregation rules. And the definition of the aggregation rules is that collaborative actions of 2 or more individuals who must in concert, and I insert synchronize, perform an activity in an aim. So these activities, they need to connect, or they need to synchronize for creating any meaningful effect and any the desired outcome for which these policies are formulated. So further, next please, the slide 10. Yeah, the measure, how the study measures synchronicity in the 2 documents that are being analyzed. This study takes 4 elements, measures of synchronicity: the purpose in the 2 documents, the actors, the actions, what they are, their roles and responsibilities, and then finally participatory collaborative implementation, and how do they plan to achieve this goal by what means, because this is what the policy tells the textual content, or on paper at least, because at this moment we are looking at the 2 documents in the context of the textual understanding the textual content of the policy. So what this research is saying that we take these four as a measure of synchronicity, and we look at it. Now the next slide, please. The next slide really summarizes what is being said. At the top is the collective choice level policy, which is the Punjab Water Act. And this is since the paper talks about the vertical synchronicity, it says it should synchronize with the operational policy, which is the manual for community training and for community managing the rural water supply, which of course is the responsibility of the Housing, Urban Development and Public Health Engineering Department. And then it has its structure at the district level and at the tehsil level. And then this structure then connects with the communities through collaborative governance process, the community-based organization and the households and the rural water supply is managed. So it's a kind of a, putting everything together in a bigger form. Next, please. So the methods that are used for measuring the four elements of synchronicity used IGRI 1.0, and the following four phases of the tried to follow, in fact, followed very strictly all the phases of parsing the two documents, of course, reading the two documents thoroughly. I continue to read this document even now if I have done, because I go back and forth. And I think this is also researchers' responsibility. You do not end it till really finalize your work. So I familiarize myself with the documents, the titles, the headings, know the intent, the context, and the structure of the policy. This tells the structure of the policy, and then the sections and the subsections were identified, separated as a unit of observation, all as indicated in IG 1.0. In the third phase, it is the subsections as unit of analysis, which were taken from phase 2, were having multiple sentences into sentence-based unit of observation. And then finally, individual institutional statements were passed into syntactic components. And for this research, only regulative institutional statements were passed. And the regulative institutional statements are, of course, I'm going to explain now. Now, altogether, the two documents have, both the documents have 447 institutional statements. The manual has 6 chapters. It's written in vernacular. It is illustrated because this is used by people right at the village level. It has 100 institutional statements. Since everybody doesn't read it, that's why this is illustrated. The Punjab Water Act 2019 has 12 chapters. Chapter 5, it relates to water. The other chapters relate to are the constitutive. There are two chapters which contain just the constitutive rules. The others relate to the groundwater usage and then the sewerage undertaker's responsibility. But since the questions relate to water only, though whole of the document was parsed, but when the analysis was conducted, this was used only for chapter 5, the relevant chapters. Next, please. So coded the regulatory statement and coded them as attribute, deontics, aim, object, condition, and or else. Where required conditions was coded as what, where, when, and how. And I coded all these, the coding was done on Excel sheet. And then the institutional statements were alongside while coding was done, and they were being categorized as rules, strategies, and norms. A column was created for rule typologies, so all the institutional statements were categorized in the respective 7 rule typologies. Next, please. This research has two questions. The first question, of course, deals with the coding, the institutional grammar coding. The second question relates to the interviews, because how does PhD connect itself to the communities? There were three interview questions which related to the synchronicity part of it, and these three were how PhD connects with communities, what authority do you have to enforce regulation like water metering, water quality testing and water bill collection, and how rural water supply are monitored and how rules are enforced. So I developed an interview template. It was a longish interview at almost like for 1 hour, but there were 5 senior civil servants and 11 operational civil servants who were interviewed to look into this. Next, please. Why did I use IG for policy synchronization? And I think it's my, I understand it as that it is very systematic, it is methodical, and it's robust when it comes to understanding the actors and their actions, and also using the rule typology. This was the reason for using IG for understanding policy synchronization. I come to the results now, and next slide, please. The overall results, of course, the coder reliability was done. I did it manually, 90%. Of course, you can ask me how it was done. It was 90% for the Punjab Water Act 2019 and 95% for manual. And let me add here, the manual's language is easy, simpler, not very complex. On the other hand, the language of the Punjab Water Act is complex, convoluted institutional statement, and sometimes it takes much longer time, to really code the institutional statements of the Punjab Water Act. The next please, next slide, please. This slide presents the results of a summary of the institutional statements and compares it of both the documents. As I said, 121, there are 22 strategies in the Punjab Water Act, 4 in the manual. Norms are 297 for Punjab Water Act, 90 for the manual. Rules are 28, lesser number, and in Punjab Water Act, and in the manual there are 6. Altogether, 347 institutional statement for Punjab Water Act and 100 for the manual. The interesting thing is the attributes. The attributes that we see, and they it is 28 times that the Punjab government is mentioned, and Punjab government comprises of 6 different departments of the government, which includes public health engineering department. The manual has only one main actor, very few main actors. It is PhD. It's mentioned 27 times. CBOs are mentioned, community-based organization, and mentioned 16 times, and community is 4 times. But the Punjab Water Act, mentions many other actors, attributes, which is Punjab Water Resource Commission, the regulatory authority, water undertaker, sewage undertaker, and director, and the lesser mentioned attributes. Next, please. And now let me start by looking at the purpose of the two documents, which is mentioned in there. And the red color shows that they are 2 different actors, right? Whereas the blue color, green color shows that it is more or less the same, purpose. So the purpose is that for the Punjab Water Act is that the water undertaker appointed by the Punjab Water Service Regulatory Authority shall supply water to any premise for domestic purposes, and this water must be wholesome at any time of supply. It's a very longish one, but I would just, written just, but otherwise it would have taken a lot of space. But But that was the core purpose. Public health engineering department shall provide safe drinking water fit for human consumption in rural areas through rural water supplies successfully involving water users. So as we move ahead in this discussion, we'll see that the difference or the lack of synchronization in the two documents. Please, the next one. Next, please. Yeah, actors. Actors. No, in slide 19, please. Thank you. Yeah, the actors. The actors, as mentioned earlier, the government may appoint a company, a local government, or a statutory authority to be the water undertaker or sewerage undertaker for any area. So it's a company, it's a local government or a statutory authority, and there is no mention of the community organization or any such things. And the other actor is the water undertaker to develop and maintain an efficient and economical system of water supply within its area. So these are the actors which are mentioned who are responsible for the supply of water for safe drinking water. Next, please. Yes, the manual 2010 mentions community-based organization shall supervise the construction, ensure the use of standard material, and in case of complaint, inform public health engineering department. So it's a involvement of the community-based organization right from the start of the construction of the rural water supply, and is responsible for that standard material is used in the construction. And after the trial run, the CBO shall be responsible to operate and maintain the rural water supply. So unlike in the Punjab Water Act, the manual gives a very clear responsibility to the community organizations and effectively involves the users in this whole process. Yes, slide 21, please. Actions. Well, the actions I'm just showing that the important ones, and we'll see the whole configuration of actors later. The actions, the most important action is the appointment of the water undertaker, and the second action, which is of course the responsibility of the government, and the water undertaker is responsible for the development and maintenance of efficient and economical water supply system. It does not say anywhere whether the community will has any responsibility for maintaining or developing, unlike that's mentioned in the manual. Supervise the construction and ensure the use of standard material. That's the responsible. On the other hand, it is different for it is different in the Punjab Water Act. Next, please. Now here it's I've tried to put together, and again, I've tried to show what is not synchronizing. There is a dotted line. One can see a dotted line here, which separates the Punjab Water Act, and the actions and the actors of the Punjab Water Act are on the top, and the actions and actors in the manual are on the lower side. And the green part, the green colored, is where the things connect, and they're the same. They're one, and here we see that water undertaker is doing everything autonomously without involving the community. On the other hand, when we see on the lower side, which is a manual, it's all done in a very collaborative way, and there is a the at least in the paper, it shows that both community-based organization and the public health engineering department are equally more or less equally responsible, and one acts in collaboration with other, and if one is not acting in a concerted way, the rural water supply scheme will either not be completed or not will function. If we look at the goals, the purpose which is given at the end, we see the purpose more or less the same as discussed earlier. It's just try to put all these things together in this form, just to look at holistically that how do they look like. Next, please. Rule typologies. So this is about the rules. The red one is from the manual, and the blue is the Punjab Water Act. And since the Punjab Water Act is a bigger document, it has more institutional statements, and the manual is a smaller document with lesser institutional statement. That also goes to show that why you see such less number of these rule typologies. These are categorized, and what is of concern for this research is that aggregation rule. We see that as defined earlier in this discussion, aggregation rule are rules which are collaborative in nature. Although the literature does tell us that its aim is to control. Well, that's a discussion that one can discuss this thing. But I see this is yes, the control, but it's also interdependence of the activities of the actions to complete a task or to achieve a certain goal. So in that way, for this research, this aggregation rule was taken as a collaborative, as defined in literature, or as defined in IG 1.0. It's taken as a collaborative rule, and what is found is that in the manual, the participatory collaborative approach is used, in which community-based organizations are equally responsible for the management of the rural water supply. Next slide, please. Interview results. There were two during the interviews. There were two very important views emerged. One view was that command and control rural water supply system was more efficient. That around 4 people out of the 11, they said they thought that command and control rural water supply system was more efficient, and this participatory collaborative community managed system, the 7 of them said that it is more efficient, but with some provisos that we need to do certain other things as well. I don't want to go into the detail of that, but that's a view that prevails there. Secondly, the manual rules can, according to the operational staff, the operational civil servants, it's the rules given in the manual which connect the public health engineering department, community-based organization, and rural communities, while the law does not connect public engineering department, or the law doesn't say anything about the rural water supply as clearly as, because the context, the demography, the culture, the politics of rural areas is different from the urban areas. Therefore, according to them, a specific mention should have been made of first this approach, and then the community-based organization. They also, their view was that rule enforcement and compliance with the rule is voluntary. There is no there is no force or authority which they can use to particularly when it comes to installation of water meters, when it comes to um, fining the free rider or disconnecting their water supply. It cannot be done because of social cultural things, and um, there is no a law which can which supports this enforcement. In senior civil servants' view, they think it's a good law because it covers a wide range of water resource sustainability. However, in their view, they ignore the this law ignores the community managed approach, which is in existence for the last 30 years. So there, something should have been mentioned about this community managed approach as well. Water metering for fair water billing. They say water metering is extremely important, although the law, which is the Punjab Water Act, mentions that water should be metered, and they think yes, water should be metered for fair water billing in both in urban and rural areas. And they also think most enforcement of rules is voluntary, and the authority to enforce is not supported by law. So this is a common element in both at the operational level and at the senior level, that the authority to enforce, at least in paper, it should be there. Next, please. So I conclude by saying that collective choice level policy and operational policy synchronization leverages effective governance, and it's important. That's what we have learned from it. We conclude by the synchronization of it's important that purposes must synchronize, they must connect, and there should be oneness in the purpose, but that's not enough. The process synchronization is important, that is the actors, their roles and responsibility, and where and when and how their roles and responsibilities are assigned to them. They are equally important. In this empirical research, we have found that roles and responsibilities and implementation approach, particularly since it synchronizes less, and there is less synchronization. So operational policies are therefore less supported by collective choice level policy, and there could be some recommendations for practitioners on this regard. Next slide, please. This is the last slide, and it only speaks about the future research. In my view, there is need to have a concept note on policy synchronicity, as well as a need for developing a framework for policy synchronicity, so that it is helpful for future researcher as well. In this research, only 3 measuring criteria are used for policy synchronicity, but I think that's not enough. We can include some more measures of understanding policy synchronicity, so one can have a conceptual note or framework on policy synchronicity. And the other thing is the nature of voluntary compliance at the operational level. What is the nature of, in the absence of less synchronicity in the 2 policy documents, what is the nature of voluntary compliance at the operational level? What are the drivers of that voluntary compliance? Why do people comply to rules, or why is it that how they do it, that's the thing. And lastly, in all this research, I found that groundwater laws need to have a study on groundwater laws, because most of the waters that is supplied through rural water supply scheme is a groundwater. And where water is sweet and we have a rural water supply scheme, people do not, there is no compulsory or mandatory requirement for a connection from a rural water supply, and people have their individually they abstract water from ground, and that has its own ramification and outcomes. So that's all from my side, and thank you very much. And once again, my apologies for all the technical hitches that came about. Thanks. Thank you, Sabat. Thank you, Uta. Thank you all.
Don't go away.
No,
Thank
I
you
won't.
very much for this very, very interesting presentation. Lots to think about. Questions?
Yeah, I'll be glad, because this is work in progress, and I will be glad to have questions and comments and anything that can be added to improve this work.
Saba?
Yep. Oh, I guess I'm muted already. Thank you, Seemi, for the presentation. One thing I've been wondering is, what synchronicity looks like between institutions, or sets of institutions that have different purposes. So I'm thinking, like, you have two kinds of policies that are fundamentally different in kind and have different purposes. And so I can't help but wonder, how much of the particular foci of the policies is, or sorry, the specific statements that you're observing, and thereby the forms of synchronicity you're observing is relating to the different functions of the policies, if that makes sense. And I guess what I'm thinking of, Seemi, is like, for several years ago, David Carter and Chris Weibel and myself, along with a couple of others, wrote a paper about kind of the correspondence between laws and regulation. And, we tried to sort of look at how the legal language and the regulatory language was complementing each other. But as part of that assessment, we sort of had to understand, or we sort of had to recognize that, well, laws and regulations do different things. The kinds of activities that they reference, the purpose of those, et cetera, are different. So I guess, I guess this is more just a consideration, not so much a question or even a recommendation, but I guess I'm wondering if you could say a little bit more about the function of these different types of these different policies that you evaluated, and how their different functions might link to expectations about synchronicity, or the kinds of synchronicity that you would observe.
Well, Sabah, if you allow me to respond to it, I'm not contesting your idea. Yes, your idea is very, I mean, I agree with it, but then I was also looking at the context in which I have discussed this, because when policies are formulated, there are political aspects to it as well, right? Why is it that it is written in the policy, not just in the manual, but I have seen other policy documents of other organizations with the same responsibility of providing water and sanitation, and they also state and mention that they should install water meters, and it's the same legal document like the Punjab Water Act. Because Punjab Water Act, as you rightly pointed out, is a law, right? Is that what you're saying? It's a law, and the function of law is different from the function of the executive order. It's another kind of it is a policy, but its function is different. Is that what you're saying, if I've understood you correctly? Yeah. So if that's the case, and one does find, for example, one common feature that one finds in both the policies is installation of water meter. And why is it, I was probing this and I asked this question from many officials at the operational level and at the senior level. Why is it that it is written in the policy document, and why it's written in the law and it's written in the policy? Why is it that meters are not installed in all the urban areas and in the rural areas? And the answer that came was that it is for political reasons, because these rural water supply schemes mm, are developed because the local legislators, they identify it as a political ploy to get the votes of the people. See, we have got a rural water supply scheme in your village, so it's us who have done it. So why is it they don't want meters to be installed? Because if you are going to start charging them, although people are willing to pay, if you ask people, they say we are willing to pay. But if you ask the officials and the politicians, they say we can't charge them. So you're right. What you're saying, absolutely, I agree with you. But then there are, I look at the political dimensions. That's why certain things are not done, which are already stated in the policy. So I was just wondering how but certainly I agree with you that the functions are different and we need to mention and talk about them. I need to talk about them.
I think that might be interesting, just in your paper, if you're not already, thinking about this, to elaborate on what are the different functions of those documents, and then, how might we expect that they would reference activities, actors, all of those kind of dimensions dimensions along which you're measuring synchronicity. And then how does that materialize or not in actual coding, and then what are the implications of that for the synchronicity?
Thank you.
Adela?
Hi, Seemi. It's good to see you again. And
hi, thank you. So nice to see you.
and I enjoyed your presentation, and I'm familiar with your work. But I thought one of the points that you raised at the very end was interesting about groundwater laws, and that the communities aren't required, if they have access to sweet groundwater, they choose not to form a water supply organization and not have a rural water supply. Instead, they depend on their own wells. Is that right?
Yes,
and
yeah.
If that's the case, why is that the case? And what lessons does that have for rural water supply policy?
The villages that I visited and I was in those villages, I found that there is nowhere written in a policy, even if it was written, I do not know how much it would be enforced, but there is nowhere written in the policy that it's mandatory to have a water connection from rural water supply scheme, even in urban areas. That's true about urban areas. It's not only about the rural areas, because it's true about the urban areas. There are many households which are not in the housing schemes or in particular localities and areas, which still abstract water in a city like Lahore on their own. Although the law of Lahore Development Authority and the Water and Sanitation Agency says that you cannot, you will be fined if you are going to abstract water, groundwater. But I think its enforcement is weak. And I think the first thing that when I said we need to understand the groundwater law, because the groundwater law is not in one policy document. It is scattered. It is in so many. So and it is also in the colonial laws as well, which says talk about groundwater. So there is no study which brings together all these laws and say what are these policies saying about the groundwater and how to enforce these groundwater laws. And that's creating a lot of problem, you know. It's just
Right.
contaminating water, yeah.
Mm-hmm. Yeah, so is that your plan moving forward, is to study all of these laws, bring them together and look at them?
Yeah, sure, that is my plan. And I have already collected the laws and I want to use IG for that as well.
Mm-hmm. Good,
Yeah,
good. Thank you.
thank you, thank you.
Thanks. So we are actually out of time now. Are there any last minute questions or comments for Seemi? Okay. Thank you so much, Seemi,
Thank you.
for presenting your work at such a late hour for you. And this concludes our seminar for today. And our next one is on July 5th. Hope you'll join us and we'll see you then. Thank you so much.
Thank you for bearing
Thank
me.
you.
Thanks a lot.
No
Thank you.
worries.
Bye-bye.
Thank you. Bye-bye.